In the farmlands of Mpumalanga, breast pain was once treated with a tablet and silence. But behind the quiet, cancer was taking hold. Specialist care was far away, and for many out of reach, until the Discovery Fund stepped in, and with the Breast Health Foundation, brought hope closer than ever before. At Tintswalo Hospital, a new promise was born.
Writing down, she said, actually we can take it out, the whole breast. And she said, and we had agreed, if they take this, they take this.
Not in a million years would I have thought it would be cancer. I just thought something is not right. Hence I went to the nearest clinic to seek help, and the reassurance they gave me said, you can't have cancer, you're still young. You bumped into something, and they gave me Panadol, and I believed them.
This clinic and the concept of this clinic started in 2018. The Discovery Fund approached us and said one of their partners in the region, Pfukani, is seeing a lot of women with breast cancers and breast-related issues, and there weren't any services in the area. And we were going to start in 2021, and then we had COVID. And everything stopped for 18 months. And in 2023, we officially launched the clinic in August with the MEC in the department, as well as management from the hospital in the region. And we are very pleased to say we now have the Pfukani Women's Clinic, Pfukani meaning rise, and that name was chosen by the patients.
The partnership between Discovery and the Pfukani Women's Clinic at Tintswalo Hospital began with a shared mission to bring quality breast care to women who had long been overlooked. Before the clinic, patients faced exhausting journeys to Johannesburg just to be seen, leaving home in the early hours, spending entire days in waiting rooms, finding a place to sleep, only to do it all again for follow-ups. It was a journey of hardship no woman should endure in search of care. But through the Discovery Fund and Mpumalanga Department of Health in collaboration with the Breast Health Foundation, which was founded by renowned breast cancer surgeon Professor Carol Ben, this vision of bringing care closer became a life-changing reality.
He set up my first unit at Chris Hani Barra. I didn't see any women with breast cancer, and the head of the hospital told me that you actually don't see breast cancer, it's an old white woman's disease. We are hoping is that we can offer a regional breast surgery service, okay, and to make sure that from a regional point of view, access for patients is easier. Because particularly areas like this, it's such big areas to cover. For people to leave their families and really battle around treatment is really hard.
In South Africa, we have a lot of challenges with service delivery and accessing treatment. And by opening a clinic in Ekonhoek, which is part of the Bushbuck Ridge region, women now have access. But it's not just about access, it's about education and awareness, because in these areas particularly, there are a lot of psychosocial challenges, socio-economic challenges, and women don't always go to a clinic to be screened because they have bigger financial responsibilities. And with the Pfukani Women's Clinic, it is now a haven within the Tintswalo Hospital where women can access services, can access treatment, and nobody has to die anymore.
We first joined forces with BHF in 2017, and really to extend quality breast health services into the underserved areas. And really because many women in these communities lacked easy access to screening and diagnosis, often having to travel long distances or simply being unable to afford care. The breast cancer is the most common cancer among women in South Africa, with 1 in 26 women facing this diagnosis in their lifetime. And this is according to the National Cancer Registry of 2022. In fact, nearly 19 million South African women aged between 15 and above are at risk. And so it was clear to us that supporting an organization such as the Breast Health Foundation that is really dedicated to education, early detection and referral system would make a significant impact in these women's lives.
We know that now breast cancer is one of the leading causes of death amongst women, followed by cervical cancer. So we know that if a family loses a woman, that family might not strive financially. Their children might not see the prospect of their future. So it is key important that as Department of Health, we partner with NGOs like your Breast Health Foundation to address these issues and assist our communities. The importance of public-private partnership is really crucial, because as health, we can't do this alone. We need sectors, private sector, to come on board so that we work together with them in addressing all the health challenges that we experience in our communities.
Even with a fully functional clinic, many women still carry fear of the unknown, of what a diagnosis might mean. But slowly, that fear is giving way to knowledge. Through education and support, women are learning to recognize the signs early. And these life-saving lessons are reaching far beyond the clinic, touching lives across the province.
I use the Big Five analogy, which is great because we're up here around Kruger. The lion is the roar. You want awareness out there, but awareness without access is useless. Access is the leopard, it's hard to see. I always say treatment is the buffalo. It's so scary, the concept of a breast cancer. There's so many things that you don't need. If you pick things up early, people do not need mastectomies. Supportive care is the elephant. Going through active treatment, it's about looking after people and their families going forward. Rhino is about service. We don't want it to become extinct, and we need to make sure we set up these little clinics where we can help people. Because the more people we bring in, the more we make communities aware, and it must be a friendly access. I don't like medicines where doctors speak down in a vertical manner. It's about a horizontal communication with people, understanding what their needs analysis are, and making sure we can help them.
Ntho phapano ya gona ke gore batho ba mo Mpumalanga ne ba tshaba go checka breast cancer, ba tshaba go checka cervix. So gone bale ba tla go checka. Nna ke a leboga ge ba butse Breast Health Foundation e butse clinic mo, because batho ba ntse ba sa gone gore ba fitlhelele go ene le go tseba ba sa tseba sa abana information about the sign and symptoms. So gone bale ge re le mo gaufi ba gona go tja di sign and maybe ba gona le go te check ka noši ba dira breast self examination bona ka bonoši. So ba thušega and ba gona go tja treatment as early detection. The
Pfukani Women's Clinic has quickly become a trusted center of care for an underserved community, offering not just medical support, but dignity and comfort. With the introduction of cutting-edge technology, breast cancer detection is now faster and more accurate, thanks to Dr. Catherine Malherbe's pioneering use of an AI-powered diagnostic scanner.
So it's a mobile ultrasound system, and it has built-in Wi-Fi. So we've had a lot of success of using it, especially in rural settings. We've used it a lot of in gynae clinics. And basically what it does during real-time scanning, it can give a risk prediction of a breast cancer mass. So especially in sites like these where there aren't specialists, it's able to give you a prediction of what they're looking at, and it helps with a better referral period, better idea of what they're looking at, when to refer, when to biopsy. So it's literally bringing a specialist to them in sites that don't usually have it.
The Pfukani Women's Clinic stands as a testament to what's possible when compassion meets collaboration. Thanks to the unwavering commitment of the Discovery Fund, the Breast Health Foundation, the Mpumalanga Department of Health, and every healthcare worker on the ground, women in Mpumalanga are no longer walking alone. Together, they've brought care, courage, and hope home.